in 2019, the term long hauler to most of us meant someone who drives a semi from the East Coast to the West Coast or the West Coast to the East Coast. So I'm going to guess that that's no longer what a long hauler is. So before we jump into all the top, could you break down real quick in physicians' terms what long hauler means? We hear this term all over the TV, especially since Donald Trump's been in the hospital. Can you break down what that means for our audience, just so we kind of have a good idea?
Sure. It's interesting. I don't know where the term actually came from, but it really implies patients who were infected with COVID who continue to have symptoms. So they're long hauling it, right? They've been at this trying to heal from this infection for months. And it seems that we don't have a clear idea yet about what a long hauler means in terms of time. There are some patients who have been sick with COVID, let's say got sick, were sick for a couple of weeks, quarantined, and then continued to have some symptoms after that. They may be considered long haulers. And we have patients 6 months or more out from infection who are considered long haulers. So these are just patients who are, again, continuing to suffer the consequences of the virus. But unfortunately, the range of symptoms that long haulers can have are really, really broad. So it doesn't describe a particular patient, it just describes how long they've been dealing with this, or that they've been dealing for a long time.
That makes perfect sense. So let me ask you this. So a lot of folks have tested positive that were at this Saturday Rose Garden announcement of the Supreme Court Justice nomination. Now, do you think these folks caught it there? I mean, how are we able to even narrow down when people are getting this COVID-19? How do you pinpoint the tracking? I know the NFL is going back. They've had investigators on the ground trying to figure out how the Titans, who are following protocols very tightly, the NFL has, I'll say this, the NFL's protocols are tighter than the White House's protocols they wear masks. They fine you for not wearing a mask. They had almost $4 million in fines in week 1 and week 2 alone for not wearing a mask on the sidelines. I mean, they have protocols that are amazing to take care of their folks. White House, not so much. A lot of reports. The Lincoln Project has reported just over the weekend that a lot of folks working in cramped quarters, they're not required to wear masks. There's not gloves. There's very little testing going on. People are getting sick and still being forced to work. A lot of different conditions that we're hearing about. Whether they're true, false, or indifferent, we do get the impression from this White House that wearing a mask up until Thursday wasn't a cool idea. In fact, Tuesday night, we all remember reaching into our pocket, pulling out a mask, and then looking over at Mr. Vice President Biden and making fun of him for always wearing a mask. So where do we go from here? I mean, are these people, was there a long hauler involved in this? Can a long hauler make it through a swab test? I mean, do the swab tests look for long haulers, or does it just look for somebody who currently has COVID?
Yeah, that's actually a great question. And I'll tell you what we know right now, but there's some suspicions of other things that I'll bring in. So generally speaking, the nasal swab, the nasopharyngeal swabs are PCR tests, and they're looking for acute viral load. Occasionally, they'll pick up dead viruses. So there are some people who continue to test positive for weeks after they're sick, and the question is, are they still infectious, or do they just have dead virus? And for the most part, we believe that after the acute illness, the virus is gone. They are not the ones spreading it, but they're the ones that have had a inflammatory immune reaction to the virus. So most of their symptoms that persist is due to the immune reaction as opposed to the virus. The virus causes the acute illness for the first few weeks. So I doubt that a long hauler who was at the White House is going to spread the infection, although I'm sure that there's always going to be exception. I always say this in medicine, nothing is 100% ever. But generally speaking, to spread, you have to have an acute viral load. You have to have replicating viral particles that are being released into the air that others are going to be in contact with. And so there was somebody at the White House at one of the events that was spreading it. And I think here's the issue with how I don't want to politicize this,
Yeah.
but I want to just say that I think from their perspective, those in government or those involved in these events, I think what happens is you get a little complacent, and you forget that you're vulnerable. The height of the pandemic back in March or April is behind some of these people. There are parts of the country that are in a major flare and spike, but there are other parts of the country where the numbers are a little lower. You start to get complacent. You start to realize that, it's not going to happen to me. Look at all these events I've gone to, right? I've been fine. And so all these people, they just continue going to the events. They continue seeing a lot of the same people, thinking that they're somehow protected because this is their group. And unfortunately, these people are going back to their communities and picking it up there and then bringing it back. So nothing is safe. And I think that that's the message, that we're not safe no matter what you think is safe to you in terms of not getting this virus. So you have to continue to protect yourself, even if you think it can't happen to me, because it clearly can. It happened to the President of the United States.
It did. You are correct. It happened to him. It's happened to not just the president. It happened to Kellyanne Conway. It's happened to so many people close to the president. It's happened to, as of this recording, 19 members of the Tennessee Titans, between team and personnel. And that doesn't include the countless Americans that test positive every day. So we have to keep those folks in mind. Now, before we go to break, one of my questions for you is, there's a lot, and I ask this not just as the host of this show, but as someone who has parents that are in the age bracket that you're always concerned about, because it seems to be the elderly are the greatest at risk for being nailed with COVID and having the really bad reactions. I know it's hard to say because I know you physicians are looking at this every day along with scientists. And by the way, I'll trust your judgment over a politician. I don't care what party they belong to. They're not doctors. So when they're telling me science, I'm like, no. That's like taking war advice from a politician who's never been in combat. I'm not asking him for assistance and making sure somebody's going to drop rounds where they need to be, because bombs, if they miss, bad things happen. I mean, it's bad for the bad guys, really bad for us when they land on us. We don't like it. So we hear a lot on TV. Friday night, it was all over. Doctors talking about zinc, vitamin D, vitamin A, vitamin C, and NAC, and a few others. Anything proven? Any advice to the folks? A lot of our viewers ask about that. We see this. We want to treat it. We're afraid, we're not going to get the same treatment. I'm not going to get into politics. The president gets better treatment than anyone else. Yeah. He's the president of the United States. I'm not surprised by that. Saying a president gets good treatment. Come on, folks. It's the president of the United States of America. I get if you don't like Trump, you don't like Trump, but he's still the president. They would give it to insert anyone's name if you had COVID. Correct. Would get front of the line treatment. Correct. He's the president. So what about these other options that we're seeing that are out here, the zincs and the vitamin Ds? Any thoughts on those? Are you prescribing those or telling your patients anything about this?
Yeah, my background is integrative medicine. So I look at all the different both natural and pharmaceutical options for the patient. And I'm all about prevention. That's my whole practice, is geared towards preventing. And so, here we have this opportunity. We have this virus. We don't know a lot about it. There's still a lot of unanswered questions. But what we do know is that, like other viruses, it affects our immune system in a certain way. And there are things that we know can help our immune system. And we have research to support this. For instance, we know that vitamin D deficiency, for years we've known vitamin D deficiency can put people at greater risk for certain diseases, infections, diabetes. We have the research on that. We now know through some preliminary research that vitamin D deficiency might increase the risk of contracting COVID and being particularly ill from COVID. So to me, it's a no-brainer. What is the downside of vitamin D? I do like vitamin D levels to be monitored. I like patients to do this under the guidance of a physician or a health, a medical professional. But But there's probably not a lot of downside on taking vitamin D, particularly in the fall and in the winter when we're not getting a lot of sun. So I think, like, to me, that makes sense. Now, everything you put in your body has risk, even if it sounds natural, right? So vitamin C is amazing, right? Everyone talks about how great vitamin C is. There are some patients who shouldn't take vitamin C. So again, I always say, you got to check with your doctor. But if you discuss this with your physician and you understand the conditions you have and you look at the things that you can do preventatively, again, I don't see the downside on that. And I think you need to be proactive with your health. I mean, that I encourage everybody to think about what you can do to be better. So there's some supplements that may be helpful. Again, needs to be individualized. And the thing that I love to talk about is diet, because I think, honestly, that probably is even more important than the vitamins. The more sugar you eat, the worse your blood sugar control is. If you're pre-diabetic, if you have pre-diabetic or diabetic, or just have any metabolic issues whatsoever, your diet is too high in carbohydrates, you're going to lower your immune system. You're going to increase your risk of contracting COVID and being particularly sick from COVID. So I love to just talk to people about cleaning up their diet. One of the things that it's really interesting is during quarantining, a lot of people went crazy with their diet. All my patients who were doing so well, and I had them on a straight track of feeling good, a lot of them got derailed because they're home, they're down. A lot of them started cooking and making these fancy dinners because they didn't have anywhere else to go. And then all of a sudden the weight goes up, the carbs go up, and then their immune system goes down. So I think that's like one piece that you have so much control over, more control than you think.
Absolutely. And I love that you brought that up, because that is very true when it comes to the way that works. I mean, just having control of your diet, I think, is important. There's a lot of people who have been getting in shape, and that's important. So, Doc, before you go, we've decided to go a little long here and just do this without having to take a break. So we do have a question from our audience that they came in yesterday because they knew we were interviewing you. So let me pull it up, because of course my phone didn't cooperate with me. Basically, the roundabout, it comes from one of our frequent followers and fans who tunes in every day, Linda Dobb. Linda asks about, it's holiday season's coming up, and there's people who want to be around their family. They're all healthy, but they want to bring food, right? Like, I guess I would go, Linda, hopefully you're talking about something like Thanksgiving, which is crazy that it's October and I'm going to talk about Thanksgiving. But according to Target and Costco, Christmas is here. So apparently I didn't get the memo. We're skipping holidays now. But what is your feedback on that? Are you recommending people, I mean, as people, number one, we're talking about Thanksgiving and dieting. There we go. There's a special term that doesn't go together. But what are your recommendations about people getting together during COVID? I mean, is it kind of one of these holidays where unfortunately you almost have to phone in Thanksgiving? I mean, but if you are going to bring something to family, what about bringing Tupperware and stuff like that? Have they proven anything? I mean, I haven't seen it. This is just a random question that came in. Obviously, you're a doctor, so you're going to get thrown these cool rando questions. But I don't know. I don't have the answer. I would think if you clean it. I mean, I haven't seen anything where COVID lives for long times on plastic or Tupperware. I mean, I really don't know. So figured I'd ask you.
No, that's correct. Yeah, no, I'm less worried about the food and more worried about being in close proximity to each other and breathing on each other.
Yes.
That's the concern. The problem is when families get together, your intention could be, we're going to socially distance, we're going to keep masks on. It's very difficult to keep that going with family that you're used to being with normally without masks. And it's one thing also to be masked, socially distanced outside with a few people, versus during Thanksgiving, at least let's say on the East Coast, it's going to be cold. You're going to be inside. You're going to be in narrow quarters. You're going to be eating, which means that you have to take your mask off. So I'm much more concerned about the spread through that means, as opposed to the food that people may be bringing. That's the lower risk. It's not zero risk, but it's low. Especially if you're going to eat the food and all that.
It